Have you ever been told that you have scoliosis as an adult and thought, isn't that just for teenagers? You're not alone. You might be dealing with something called degenerative scoliosis. And in this video, I'm going to break down what it is, what causes it, what symptoms you want to watch for, and the most effective non-surgical treatment options available. Hi, I'm Dr. Chris Gubbels, the head clinician at ScoliCare Denver, Colorado. And we are dedicated to helping adults find the right treatment at the right time with the evidence-based non-surgical treatments that actually work. So if you have degenerative scoliosis, at any time you can click on a link below in the description and request a free discovery call, and that's going to give you a chance to talk to me about your scoliosis and what can actually be done for it. So what exactly is degenerative scoliosis? Degenerative scoliosis is a type of scoliosis that actually develops or progresses in adulthood, usually after the age of 40 as the spine begins to break down. Now, unlike adolescent scoliosis, which starts in childhood or during teenage years, degenerative scoliosis happens when the disc and joints start to break down and decay and wear over time. This can cause the spine to curve and twist, leading to what we call scoliosis. Now, there are two types of degenerative scoliosis. Type 1 is a scoliosis someone actually has when they're younger and turns into degenerative scoliosis during adulthood and then continues to progress and worsen over time. The second type of degenerative scoliosis actually starts during adulthood, and it's called the degenerative de novo scoliosis. You see, de novo actually means new, so it's a new scoliosis. Now, people with de novo scoliosis did not have it when they were younger, and it typically develops around the age of 50, especially with the onset of menopause in women. Now, some of the common symptoms include persistent back pain, and the pain is more likely to be on the side of the scoliosis curve. You may see some visible changes in posture. You may notice a lean to one side where the body's starting to tip back, and that's usually accompanied with a forward hunch or lean over time. If you look at this picture right here, this shows what we typically see in an adult with degenerative scoliosis. They start to tip or lean to that side, and when you look at them from the side, they start to lean or hunch forward. It's also common to get radiating pain or numbness or tingling that could be down the back of the leg, but frequently it's down the side or the front of the thigh. There's also something called intermittent claudication that typically develops in adults with more severe degeneration. And what this is when someone starts to get pain in their legs with standing or walking. Now, this is ultimately caused by something known as stenosis, which means narrowing of a canal. So you can get narrowing of the spinal canal itself where the nerves come down, or you can also get narrowing in the openings where the individuals come out. Either one of those is what actually causes the ridiculous symptoms people frequently experience with a degenerative scoliosis. Another common symptom is to feel off balance or notice a reduction in your balance, possibly frequently falling. And another sign of this degenerative scoliosis is a reduction in height. Now, we naturally do lose some height with age over time, but people with degenerative scoliosis will notice a more severe or a greater reduction in height as we age, because with degenerative scoliosis, as gravity's pushing down, the spine or body literally collapses under the weight of gravity. So why exactly does degenerative scoliosis get worse over time? You see, degenerative scoliosis is caused by the gradual wear and tear and breakdown of the spine. You typically get an asymmetrical degeneration of the disc, meaning one of the discs starts to break down, and then you get breakdown or decay of the joints, specifically the facet joints on their side. This graph right here explains how degenerative scoliosis progresses. So you get some asymmetrical degeneration. That means the disc and the facet joints on one side of the spine tend to break down and decay. That leads to asymmetrical deformation of the joints. That leads to asymmetrical loading. So you get asymmetrical degeneration, you get asymmetrical alignment, and then you get more asymmetrical loading. And that process goes round and round. Now, in the case of those people that had a scoliosis when they were younger, they had asymmetrical loading because of the misalignment. But that leads to this process also going round and round. So from the big picture, you can imagine if you have a misalignment in the spine, there's going to be more pressure on part of the joints compared to the other. And when you have that asymmetrical pressure, that causes asymmetrical wear and tear, and that causes the bones to get asymmetrical formation. And as you get asymmetrical formation, that curve gets bigger, so you have bigger asymmetrical misalignment, more asymmetrical pressure on the joints, then you get more asymmetrical wear and tear. And that process just goes round and round as the curve continues to progress and gets more and more unstable over time. Eventually, the spinal ligaments that hold the spine together can no longer hold the spine together, and you'll see lateral slipping or the vertebrae actually slipping off each other. that's a sign that a scoliosis is more likely to progress faster and faster over time. Additionally, as we age, we naturally lose muscle mass and strength over time, and this really picks up after the age of 60. On average, after the age of 60, the average person loses about 3% of muscle mass and about 5% of muscle strength. And some research suggests it's when you have atrophy or shrinkage of the deeper core stabilizing muscles, specifically what's called the multifidus muscles, that is associated with a progressive degenerative scoliosis. So we have a couple things going on. We have asymmetrical wear and tear, plus we have a loss of the muscle size and strength that are responsible for holding us up and supporting and stabilizing the spine. Basically what happens as you age, if you have degenerative scoliosis, you're in a tug of war with gravity. Gravity's pushing down and your spine starts to collapse under the pressure of gravity. If you look at this graph right here, this shows how scoliosis develops over time or progresses. This is when most scoliosis develops in teenagers for those that had it when they were younger. Typically, there will be a slow gradual increase through early adulthood, and then around the age of 40, the rate of progression really starts to pick up, especially with around 50. And as we get older, the curves tend to progress faster and faster. Now, the rate of curves can vary, but generally speaking, for people that had a curve when they were younger, those curves tend to progress at about 1 degree per year. But as we get older, they can progress a little bit faster. For people that have a new scoliosis, that degenerative de novo scoliosis, the scoliosis that actually develops in adulthood, those curves tend to be more aggressive. On average, those curves progress at about 3 degrees per year. Now, those are the averages, but everyone's different. You may progress slower, but you may progress faster too. But let me show you a textbook case of what this adult degenerative scoliosis typically looks like as someone progresses or ages. This is the case where we had a 48-year-old female that went to her doctor because she was developing pain. At this point, you don't really see any scoliosis. If you have a really keen eye, you can see some asymmetries where it's bigger on the outside and smaller on the inside. But what we do see is there's a misalignment in the spine from the side. There should be a nice normal curve. And we know when we have a loss of that normal curve, that makes the spine less stable. And that could have been what actually led to this person developing scoliosis. She was recommended doing chiropractic treatment. She could get an off-the-shelf brace, one of those like Velcro braces you put on, and then possibly do physical therapy. Well, she didn't really do anything, and this is what it looked like after going from 2004 to 2013. It took 9 years, and at this point, she's 57. And here you can actually see that scoliosis develop. You have an asymmetrical alignment. You have the disc wearing down more on the inside than the outside. That's the asymmetrical wear and tear. And the bone is starting to slip off, so it's unstable. Now what's interesting is she started menopause at 52, which is when this really progressed. It took her 9 years to go from here to here, but it only took her 2 years to go from here to here. Now you can see that curve is progressing. Here she's 59 years old. She has more severe degeneration on the inside compared to the outside. She has more severe slippage and the curve is progressing. And now her curve is actually reversed when looking at it from the side. And then this was her 1 year later. More severe degeneration, more severe curve progression. You can see the curve is reversed and you can see the spine is really unstable and slipping off really severe. So that is an excellent example of how a scoliosis can begin in adulthood and progressively gets worse and worse and typically starts to get worse faster as we age. But here's the good news. With early intervention, we can actually slow or stop the progression and reduce or eliminate pain in people with degenerative scoliosis. And the earlier we treat it, the better. You see, all big curves start as small curves. And we treat these curves when they're smaller, and when adults are more flexible, we can get even better results. The problem is a lot of people don't start to experience more severe pain until later in adulthood. But the research is clear. We'd be better off treating adults when they were younger before these become severe. Because when someone's younger, their spine's more flexible. And when someone has a more flexible spine as an adult, many times we can actually reduce the size of the curve and not just slow or prevent the progression of the curve. Now, one of the best papers out there on treating adults with degenerative scoliosis was published in the Archives of Physical Medicine. And in this research paper, they followed patients over a 15-year time frame. And they followed both types of scoliosis. They looked at people that had scoliosis when they were younger, that developed or turned into a degenerative scoliosis as an adult. And they also looked at people that actually developed a degenerative scoliosis when they were an adult. Now, over the first 10 years, they didn't do any treatment. and the average person's curve got about 1.5 degrees worse per year. When you look at the research, the ones that had the degenerative scoliosis, they got about 3 degrees worse per year, and the ones that had it when they were younger and still had a curve when they were as an adult got about 1 degree worse per year. Let's take a look. This is the actual research study I was talking about. They're looking at the effects of bracing in adults with scoliosis. And the black lines you see here is the first 10 years of the study where the patients didn't have any treatments. Here you can see the degenerative scoliosis, the ones that developed it as an adult, their curves were progressing very, very rapidly. And you look over here, the ones that had it when they were younger and they still have it as an adult, they were progressing gradually. Now the black line is the first 10 years with no treatment. The last 5 years, they had the patients start to wear custom braces up to 6 to 8 hours a day. And where you see the line start to go down, that's because the curves actually reduced. And so you see the rate of progression either stopped and the curves got better, or the rate of progression gradually slowed. Now when you look at all the patients combined in the study, the average person's curve got 1.5 degrees worse per year, or over the first 10 years, 15 degrees worse. That's a lot. But then when they had them wear the custom braces, just 6 to 8 hours a day, the average person's curve only got 1 to 2 degrees worse per year, or about 0.1 to 0.2 degrees worse per year when they started wearing a brace. So the authors concluded that these custom braces, also known as orthosis, could be effective in slowing down the progressive rate of adults. Their tolerance was actually really good, so people actually had no trouble wearing the brace, and it presents a really good option as an alternative to surgery in adults with degenerative scoliosis. Now, another treatment option for adults with scoliosis is scoliosis-specific exercise. And how this is different than traditional exercise is we actually teach people how to put their body in a 3-dimensional or in a corrected position, and then we actually strengthen and stabilize them in a correct position, and then we teach them how to go about doing things they already do in their everyday life. It could be brushing their teeth, it could be cooking, it could be doing simple chores or tasks around the house while they hold their body in a correct position. So what this study found is scoliosis-specific exercise can reduce the progression of severe curves in adults with idiopathic scoliosis. And specifically, they followed the patients over a couple of years of doing treatment, and 75% of the patients actually improved their scoliosis size by 3 degrees or more. So they concluded that scoliosis-specific exercise could be superior to natural history, meaning you're better off doing scoliosis-specific exercise than doing nothing on its own. So I showed you one study looking at scoliosis bracing. I showed you another study looking at scoliosis-specific exercise. But what if we do them both at the same time? That's what our next study shows. So this study looked at adults being treated combining bracing and scoliosis exercise. And in the study, they said 68% of patients had no pain after treatment, 53% had reduced curve size, and they said, although you can get results with exercise alone or brace alone at improving posture and reducing pain, more commonly, the best results when we combine scoliosis-specific exercise with custom bracing. See, as I previously mentioned, when you have degenerative scoliosis, you're in a tug of war with gravity. And as gravity's pushing down, the body tends to collapse. So you need some kind of treatment to stabilize you and prevent the body from collapsing under gravity. That's what custom bracing does. Custom bracing actually prevents the spine from collapsing. It also allows people to relieve pain, and they're also very effective at relieving pain. So on all adults with degenerative scoliosis, we almost always recommend custom bracing. But as I previously mentioned, another part of the problem is muscle atrophy as we age. A lot of people come in very deconditioned. So there is a strengthening component to the treatment that's also very effective. That's where scoliosis-specific exercises come in, where we actually teach people how to put their body in the correct position, in a more upright and aligned position, and then we actually strengthen and stabilize them in that position, and then we teach them how to hold that position while they do things in everyday life. What we're literally doing in adults with degenerative scoliosis is we're changing the natural history of where these curves would progress on their own. You're not making someone brand new. The goal of adults with degenerative scoliosis is to reduce or eliminate pain, to stop or slow the progression of the curves, and enhance the quality of life, meaning making it easier for patients to do the things that are most important to them and allow them to do the things they enjoy as long as possible. For many older adults, this could mean being able to stand or sit for longer periods of time without pain, being able to go for walks for longer periods of time, being able to do things like go to the grocery store and get groceries without pain, being able to do cooking and cleaning around the house without pain, basically allowing people to have their independence longer and get the most out of that last 2 or 3 decades of life. You're literally changing how the last 10 to 20, 30 years of someone's life looks like with the proper treatments. And as I previously mentioned, if someone has a scoliosis and we know it's becoming painful and there's a history or there's some evidence of it progressing or they're a high risk of progressing, we would ideally like to start doing some treatments when someone's younger, in like their 30s or 40s or maybe even earlier that. The earlier we can actually start doing some things proactively, the better those later years look. So if you're watching this and you have scoliosis, I'm going to encourage you to, one, at a minimum, download our free ebook called Scoliosis Knows No Age Limit. That talks a lot about degenerative scoliosis. But even more importantly, click on the link in the discussion, request a free discovery call, and that's going to give you a chance to talk to me one-on-one about your scoliosis and what can be done about it. Now, to learn more about the most effective non-surgical treatment options for adults with scoliosis, click on our next video where we discuss that. And always remember to stay ahead of the curve.